Hello, and welcome to another episode of the Society for Pediatric Pain Medicine Visual Pearl series. Our topic today is the American Academy of Pediatrics Clinical Practice Guidelines on Acute Pain Management and Opioid Use in Children. These guidelines represent years of dedicated work by a multidisciplinary team to promote safer, evidence-based practices in pediatric pain care. These guidelines were created to address growing concerns about opioid misuse and safety in children. They provide evidence-based recommendations for anyone prescribing opioids to pediatric patients. We collaborated with experts in addiction medicine, pediatricians, implementation scientists, guideline development experts, and even a parent representative. Our task force included Dr. Bob Wilder, past president of the SPPM, who represented anesthesiology and pain medicine, Dr. Scott Hadland, a pediatrician and addiction specialist. Emergency room physicians and pediatric surgeons also contributed their expertise, ensuring a well-rounded approach to pain management. In this episode, we'll review the key action statements, or KAS, from these groundbreaking guidelines designed to enhance patient care and safety for all providers prescribing opioids to children. Key Action Statement 1 focuses on using a multimodal approach to treat acute pain. Start with medications like acetaminophen or nonsteroidal anti-inflammatory drugs and incorporate non-pharmacologic strategies such as heat, cold, stretching, or distraction. Holistic therapies like cognitive behavioral therapy and relaxation can also enhance pain management for a comprehensive and effective approach. Minimizing opioid prescribing is critical to reducing community opioid use, the risk of adverse side effects, and the potential for conversion to chronic use. When opioids are prescribed as part of a multimodal approach, they can be used at lower doses, which helps decrease side effects and improve safety. The use of other medications in combination with opioids may further reduce opioid-related risks. When opioids are prescribed, they should be given in the smallest effective dose for the shortest possible time. KAS4 strongly recommends against prescribing codeine or tramadol in several high-risk scenarios. For children under 12, these medications should never be used due to the risks of respiratory depression. Adolescents with conditions like obesity, obstructive sleep apnea, or severe lung disease are also at increased risk. Similarly, codeine and tramadol are not recommended for post-surgical pain after tonsillectomy or adenoidectomy in anyone under 18 or for individuals who are breastfeeding. These precautions are essential to ensuring safety and managing acute pain. KAS5 emphasizes caution when prescribing opioids to children or adolescents taking sedating medications, such as benzodiazepines. Combining these drugs increases the risk of serious side effects like respiratory depression. If co-prescribing is unavoidable, careful monitoring is essential, and non-opioid or multimodal approaches should always be prioritized. KAS6 strongly recommends prescribing naloxone to all pediatric patients discharged with opioids. Families should be counseled on recognizing the signs of opioid overdose and how to respond effectively. Naloxone availability is also encouraged in community spaces like schools and clinics, as its impact extends beyond the patient to protect everyone in the household. While the data is largely anecdotal, naloxone is a proven life-saving intervention with minimal downside and significant potential benefits. KAS7 focuses on educating caregivers about the safe storage and administration of opioids. Medications should be securely stored in locked containers, and all doses should be directly supervised to prevent accidental ingestion or misuse by others in the home. These steps are essential for ensuring safety in households with children and adolescents. KAS8 emphasizes educating caregivers on the safe disposal of unused opioids. Families should have a clear plan, such as using local take-back programs or verified disposal sites. Resources like Don't Rush to Flush, a California program, can help locate nearby disposal options, ensuring proper and safe handling of leftover medications. KAS9 emphasizes careful opioid use in children with chronic pain. When necessary, providers should coordinate with other prescribers and consult specialists in pain management, palliative care, or opioid stewardship to create a safe and effective treatment plan. This guideline also highlights the long-standing inequities in pediatric pain management, particularly among communities of color. These disparities can have serious health and mental health consequences for families. Providers are encouraged to monitor equity measures such as race, ethnicity, preferred language, and insurance status, and to take proactive steps to address and resolve any disparities in care. These guidelines set a new benchmark for safe opioid prescribing in children. Their success depends on provider training, the use of tools like electronic health records, and educating families on safety. By promoting multimodal approaches and addressing inequities, they aim to improve care and outcomes for all pediatric patients. Contributors to this visual pearl include Dr. Rita Agarwal. Dr. Carol Lynn led videography and production. This presentation was created with the assistance of AI and carefully reviewed by experienced medical professionals to ensure accuracy and quality.